Welcome to the first lesson in Module 1, Setting the Stage to Who We All Are. In this lesson, you will be able to describe what person-centered means, contrast person versus system-driven supports, and name at least a few key concepts of person-centered planning and delivery. Please note, while this training is for providers, people who receive supports, their families, and advocates are certainly welcome to view the training. A person-centered planning, training, and toolkit for people who receive supports and their families is available on the Adults with Brain Injury webpage. Let's walk through a few assessment questions. How person-centered do you think you are? Take a moment to reflect on what answer you would give. Does person-centered mean you are heard? What you think matters? What's important to me is just as important as what's important for me? Maybe it means you are included in all conversations and decisions. If you think it's all of the above, you are correct. What are some common person-centered beliefs? Common person-centered beliefs include that all people, regardless of age, ability, or role, should be supported to have a vision for their good life. That all people exist within the context of their family, their friends, and their community. Finding our way to a vision for a good life starts first with understanding what is important to a person. People drive the system of supports available to them, and all people are valued members of their community and are treated with respect and dignity. What are some common person-centered myths? One common myth is that a good plan is the same as a good life. Sometimes people believe that person-centered means that everyone gets what they want, or that person-centered is all about planning. All of this is not true. Person-centered is a change in the way we think and do things. Which of the following is the most important role a provider can have? A provider should help a person to develop a plan that includes all needed services. Likewise, the provider should help the person find their vision and their hope for the future and identify what's important to and for them. Of course, providers should help a person to make choices and stay safe. All of these are important roles that a provider can play. The most important role that a provider could have, though, is to help the person find their vision and their hope for the future and identify what's important to as well as for them. What are person-centered supports? All of these are supports that are person-centered. When working with the person to build their plan, you should take into account the relationships that matter to them, the technology that supports them, their own unique strengths and assets, the community supports that they have in place, such as their support group or their church, as well as the publicly funded supports that you can help them connect to, such as through Medicare, Medicaid, or other federal and state and local funding. Which are good person-centered practice tips to use when helping a person with brain injury to reach their goals and independence? Yes, all of these are good person-centered practice tips. You should ask questions to understand who they are and what matters to them, be mindful of memory challenges, speak slowly and allow time for a response, help the person to establish a flexible, unstructured daily routine, present one idea or request at a time, and limit the background noises and distractions that might be present. You can also talk with their loved one about their needs and consider breaking the planning sessions into different appointments if needed to address fatigue. Each of us want to live lives where we are supported by and contribute to our communities. We want to have our own dreams and our own journeys. We want to have opportunities to meet new people, try new things, have a career, and choose where to live and who to live with. It's important for us to have what we need in our everyday life to stay healthy and safe on our own terms. But it's also important for us to have things that are important to us, people who are important to us. This is why it's especially critical to approach a person with brain injury through a person-centered lens. Doing so can change the trajectory of their life. Being person-centered might require you to change the way you think and do things. Historically, a systems-driven approach was and still is widely used to support people with disabilities and chronic conditions. When we think about a person who initially is recovering from a brain injury or a disability, we often consider the intensive medical, rehabilitative, and habilitative interventions that people actually receive. Often, people with brain injury are considered patients in a system where the provider or the professional knows best. The system driven approach to service delivery focuses on specific diseases and conditions. Often there are meetings about the delivery of care to the person that actually don't include the person. The focus is on fixing deficits. Our language and action focus on diagnostic labels and not the person as a unique human being. Instead, what if we all thought about flipping things around a bit? Instead of a focus on deficits, let's consider what we want in our own lives. All of us expect to drive our own vision for a good life. We set our own goals. We take steps forward to meet those goals. We actually choose to act on our own choices. Why would we see this any differently for a person with a brain injury? Having a brain injury does not mean that there are no longer dreams or goals in life. In a person-driven approach, the person leverages their strengths and assets, the relationships in their life, their community, their technology, and those programs that are eligibility specific, such as the brain injury waiver or outpatient neurorehabilitation services through Maine Care. All of these are important contributors to a person's life. The reality is that in a person-driven approach, the person is the center of all decision making. Before we get started in this lesson and through the lessons that follow, it helps to understand what we mean by person-centered thinking and how that is different from person-centered planning and practices. The U.S. Department of Health and Human Services defined person-centered thinking, planning, and practices. Person-centered thinking focuses language, values, and actions toward respecting the views of the person and their loved ones. It emphasizes quality of life, well-being, and informed choice. This is a foundational element that leads to listening and valuing each person's contribution, both past, present, and future, to themselves and to their communities. It's a culture shift away from a systems approach to one that supports rather than fixes a person. It sees the potential and not the deficit. Person-centered planning is directed by the person with helpers they choose. It is a way to learn about the choices and interests that make up a good life and identify the supports, both paid and unpaid, that are needed to achieve it. This is called discovery. It is finding out what the person's vision for a good life is and then identifying into actions that are needed to help a person reach those goals. Person-centered practices are present when people have the full benefit of community living and supports that are designed to assist people as they work toward their desired life goals. These are the outcomes we want for ourselves and for all people. It's about each person's unique journey to the good life they envision. To illustrate person-centered thinking, planning, and practices, let's watch a video developed by the brain injury community in Washington State.
We live in a society made up of systems that sometimes brush aside the critical importance of the individual. Implementing a person-centered culture and approach is an effective way to balance the power of the individual with the power of systems. By putting the individual at the center of the conversation and removing the assumption that we already know what's important to them brings about new awareness and possibility. Person-centered practices are simple tools that work to help people clarify what's important and to help them develop a simple plan they can implement. Every person is unique, and the service system must be able to respond flexibly to each person's situation, strengths, needs, and preferences. In doing so, our aim is to ensure the service system is driven by the very people it supports. Person-centered practices were originally born out of a necessity to listen to people, acknowledge their truth, and assist them to take action. In order to more fully understand another person's experience, a good place to start is to explore the questions as they apply to your own life. In the spirit of empathy, spend some time in your own inquiry by simply asking the questions we've laid out in this video before helping others. It will give you a well-informed perspective of what it feels like to be asked these questions. Focus on the elements you think would be helpful to the person, tailoring your questions and approach to the conversation. We open with seeking to understand your current state. This is the best place to start. Ask open-ended questions and follow-up responses by repeating what is being said to fully understand what is being communicated. This will be beneficial for you and the person, as it will stimulate deeper reflection. Seeking to understand someone is more about building trust than finding solutions. The solutions will come from the conversation. A simple opening question could be, "How can I help you?" The second element is envisioning the future. Picturing your future and what you want it to look like is critical to bring it into reality. Take several moments to thoughtfully consider the big picture. This will make it easier to understand what steps need to be taken to get the result you seek. Here are some questions to consider. What do you envision for your future? Don't limit yourself and think big. What does success look like? Understanding strengths and leveraging your abilities and capacities is element 3. Once you have established trust, it's easier to get people to realize what tools they already have to solve their problem. Helping them list and acknowledge those resources can allay fears and give them confidence. You may want to ask, what strengths, abilities, and gifts do you bring to the situation? Element 4 is exploring challenges and barriers. This step has a way of giving your path greater clarity by helping you do some honest reality testing about what is possible. It also gives you strength by providing insight into what types of actions you can take to overcome challenges. Living your dreams and overcoming challenges equals perseverance and resilience. Consider what we just discussed and ask, what barriers are keeping you from implementing your future? Element 5 is tending the future. Your life will be difficult to direct if you are not intentionally finding ways to care for yourself along the journey. Acquire a new skill, join an activity or support group, establish daily routines for health and wellness. Your future will not be yours without actively reaching for it. Here are some questions for discussion. How do you define success? What actions, behaviors, or beliefs can you adopt that will make your future a success? Asking for help is element 6. You don't have to do it alone. In fact, you shouldn't. Seek out the support of others through family, friends, or service professionals. People want to help. Be clear about what you are requesting. Keep it simple. Often people are honored when asked to do so. Give them the opportunity to help. You won't regret it. Take an inventory of your relationships and ask, who is on my team and how can they help me to implement my plan? Our 7th and final element is stepping into the future. Taking action on what we want in life is the only way to fully realize that life. But you don't have to do it all at once. Take small steps that connect directly with your future. Seek the help of others. Don't give up, even when it becomes difficult. That is part of the reward of making your own life, the one you truly want. In preparing to take the first step, ask, if my success was assured, what bold steps would I take? The future is yours for the taking. What are you waiting for?
After hearing this video and reflecting on your awareness of person-centered thinking, planning, and practice, what is your biggest aha moment? What is one thing you can do to be more person-centered than you are today? Take a moment to jot down your thoughts or talk about what you learned with someone you work with. You can use your workbook to record your reflection. Feel free to click on these links for references used to develop this lesson. Thank you for engaging in this first lesson in Module 1, Setting the Stage to Who We All Are.